Welcome to the Medical Report. We have a topic today which I think will be of great interest and a rather common problem in our community, namely chronic low back pain. To discuss this with you today is Dr. Matthew Schaeffer. Dr. Schaeffer is a member of the Chester County Orthopedic Associates. He is a board certified in physical medicine and rehabilitation. Dr. Schaeffer is a local person who went to Episcopal Academy. Following that, he entered Emory and then came back to go to Templeton Medical School. He did his training in physical medicine and rehabilitation at Stanford University and was an outstanding, apparently received an award for being an outstanding physician during that training program. Following his residency, he did some special training and skills for spinal cord injured patients. And he spent 4 years at a very prestigious area, Mount Tom Spine Center in Marin, California, and then came back to Redding in the Neck and Spine Center. He apparently had some chronic low back pain, or acute low back pain as a youngster with the chronic problems, and has developed an interest in that associated with sports as well. So he is he is certified in not only the American Board of Physical Medicine and Rehabilitation, but also by the American Board of Electrodiagnostic Medicine. And this particular specialty is especially where the electricity of the muscle and the nerve is measured by certain components, and is a very diagnostic tool that many of you may be familiar with. He's a very active member in the International Spinal Intervention Society and has lectured extensively on this. So I think we have someone here today who has a great deal of familiarity with the problem. He has been in practice for 10 years, so even though he doesn't look it, he has been. So welcome, and we're looking forward to your discussion. Could you define for our audience exactly what one means by chronic low back pain?
Well, I'd be happy to, Dr. McCabe, and thank you for having me here, and I appreciate the opportunity to talk, and I think that some of the viewers have met me before in my office in Westchester with Chester County Orthopedics. So the topic is chronic low back pain today. And what chronic low back pain is back pain that has lasted longer than 3 months. This is how we define it clinically. Some research protocols require the back pain to be present for longer than 6 months. But for most of us, after 3 months, we would consider it chronic. This is not the back pain where you reach over and strain your back gardening or overdo it in a sporting event and you have a mild to moderate discomfort. What we're talking about is pain that's persisted. We're talking about that gnawing, aching pain that is like a companion with you sometimes through life, a companion that you'd like to really ditch.
So if someone has this now for 3 months or so, what are some of the causes of chronic low back pain?
Well, I think to get into the most common causes, I'd like to talk a little bit about anatomy first. Because most of chronic low back pain has its origin in the spine, not the surrounding muscles of the back, but the spine itself. And what we have here is a model of the spine. And this model shows us the base of our spine, which is called the sacrum. And then we're looking, by the way, posteriorly, or at the backside of the spine. And so we have the sacrum on the bottom, and then above the sacrum we have joints. And these joints are called facet joints, or Z joints for zygapophyseal joints. The common term is really a facet joint, and it's easier to understand and remember. But a joint is where two bone meets. Okay? And these joints are true joints. They're called diarthrodial joints, just like your knee. They have two bones and they have cartilage in between. They have a capsule around them and they contain some fluid. And these joints are used so that we can bend forward and backwards. And the joints extend all the way up our lumbar spine. I'll also just mention some names of these other structures in the back of our spine. We refer to these as spinous processes, and these are part of the posterior elements. And we refer to these wide bones here as the lamina. If we turn the spine to the side, up front, we can see that it's really made up of bones stacked on one another. And these bones are called vertebrae. And we label them L1, L2, L3, L4, and L5. And in between the bones, we have cushions in our spine. And we call these cushions discs. The discs are made up of two parts. The inside of the disc is called the nucleus. It's like Jell-O. You can put your finger in it and wiggle it around. And the outside of the disc is really what's holding the Jell-O in. It's a thicker, more tensile, collagenous structure called the annulus. So we have discs, we have vertebra, or the bones stacked on one another. And then if we turn the spine on its side, we see that we have these holes. And these holes are called neural foramen. Now, out the holes, we can see these yellow things. And these are depicting nerves. So out each foramen or hole, we have the spinal nerves. Now, these spinal nerves form bigger nerves that supply your back, your buttocks, and down your legs. Without these nerves, you wouldn't be able to lift your foot up and walk. Without these nerves, you wouldn't be able to feel when you're walking on gravel. So we have spinal nerves on the side. In the back, we have these facet joints. At the base, we have the sacrum. Now, this model does not have the pelvis attached to it, but that would sit right here where my hand is. And in fact, there's a big joint between the sacrum and the iliac bone of the pelvis, and we call this joint the sacroiliac joint. This can be a common cause of pain as well. Now that we understand about some of the spinal anatomy, I'd like to answer the question about the common causes of chronic back pain. I'd like to use this poster up here. In this poster, for orientation, this is a side view, or what's called a sagittal section, a cut through the spine. And we can see the sacrum at the bottom. The buttocks, for orientation, is back here. The front of the person is up here, so the belly would be on this side. But this is the sacrum, and we have the bones or vertebrae stacked on one another. And in between these bones here and the spinous process, or posterior elements here, we have the spinal canal. And the yellow structure is depicting the spinal cord and or spinal nerves. Now, this artist rendition shows cracks in the bone, and these are depicting osteoporotic compression fractures. So some of chronic back pain can be from actually fractures of the bone. If we go a little bit lower, the artist has drawn a nice disc here, and it's shown a big crack in the disc. And we call this an annular tear, or a tear in the disc. This also causes chronic back pain. If we look just towards Dr. McCabe, we can see that the disc is protruded out or extruded out. These are words that we use to designate a disc herniation. And this is another common cause of chronic back pain. If we look a little bit more carefully, I don't know if you can see this on the camera up here, if we could zoom in on this right here, but this is depicting a little bony protuberance off the vertebrae. We call this spondylosis, but this bony protuberance can stick into the spinal nerve and compress a nerve and cause chronic back pain. This is a common thing that happens in degenerative spine disease, which is common in patients older than 70 years old. if we go back to this model, I want to show another common cause of low back pain. It's these joints. If you look at these little tiny facet joints here, you have to understand that these joints are carrying the majority of our weight every day. In fact, some research studies have shown that 40% of chronic low back pain in patients older than 55 is really coming from these facet joints. And that comes from Nikolai Bogdag, one of our most illustrious researchers in our field. So these little joints, what happens is they break down, they get degenerative, and they start to hurt. Just like in the knee, when we lose our cartilage in our knee, it starts to rub bone on bone, and it builds up inflammation and then pain, and sometimes the knee swells up. The same thing happens in these little joints. That is called facet joint pain or facetogenic back pain. Staying on the model and on the joint theme, this other big joint right here, the sacroiliac joint, this is thought to cause 10 to 15% of chronic back pain. And so joint pain is a large cause of chronic back pain. I'd like to switch gears a little bit and talk about the disc, which I think is often considered to be the most well-known cause of back pain. When people have chronic back pain, you commonly hear them say, "My disc is out." And what they're really saying or what they really think that is happening is that the disc has herniated or extruded. And on this model, we see this red blob. And what that's depicting is the nucleus of the disc, the inside of the disc, squirts through the annulus and then chemically irritates or presses on a nerve. And it really can cause pain in a number of ways. Just the tearing of the outside of the disc can cause pain in and of itself. The outside of the disc is innervated by a little nerve called the sinovertebral nerve. And so just having a tear, not even a big disc herniation pressing on a nerve, just that tear itself can cause chronic back pain. Now, if the disc or the nucleus material herniates all the way through the tear and bulges out like this, it lights, in effect, a chemical fire. Yeah, it's a big irritant to the surrounding tissues, the nerves, the soft tissues, the muscles, and it causes quite severe pain. When it herniates out, that's often that sharp, stabbing, knife-like pain. And then as the chemicals irritate the nerves, we get into more burning or aching, constant discomfort. I want you to think of the disc herniation or discogenic pain as two parts. The first part is that chemical fire there, and then the second part is a mechanical compression of the nerve or a mechanical narrowing of the spinal canal. I wanted to back up for a second and talk a little bit more about the spinal anatomy to add another cause of chronic low back pain, and that cause would be from spinal stenosis. And the word stenosis is just a Greek word that means narrowing of a canal. And so what happens is we have narrowing of this spinal canal. And this is the spinal canal, or the space that runs from the top of our head all the way down to the sacrum. And I want you to notice that there's many different holes or access to the space. Between this lamina and this lamina, we call it the interlaminar space, or this lamina, the interlaminar space. The hole or foramen on the side we call the transforaminal space. And this is another way to access that spinal space. Way down at the base of the spine, we have these other holes. And these holes are called sacral foramen. And it might be hard to see, but there's actually a big hole right here called the sacral hiatus. And so if we have spinal stenosis or narrowing of the canal where these nerves are trying to exit, that is a common cause of chronic low back pain.
Well, this has been a terrific anatomy course, and I think I'm pretty sure it was clear enough for everybody to understand it. So we're going to take a break for the moment, and when we come back, we're going to talk about a little bit of the diagnostic studies that you might want to do in preparation for some of the newer therapeutic efforts that you have for this particular disorder. So stay tuned, and we'll be back shortly.
Thank you.
Welcome back to the medical report. For those who are just tuning in, we have today Dr. Matthew Schaeffer, who is a board-certified rehabilitation and physical medicine physician who specializes in low back pain. And he has gone through the first session explaining the anatomy of the low back and some of the parts of the back that can cause some trouble. So what we're going to talk about first in this session is some of the diagnostic